Hello everyone. Oh, this is so. How are you? I have this. That's why I forgot. Like Madonna. Oh, I'm not used to this. Hello everyone. So I'm Luca, and it's very nice to see you all, and it's great to be part of this forum. Yes, as Mark was saying, we just had 3 days training with 30 sex workers from 8 countries, which ended a couple of hours ago. So it was very intense, very exciting, but a little bit tiring. So I hope I make sense. So my presentation is around stigma and discrimination faced by sex workers. These are some of the organizations we're mentioning. So I work for the European Sex Worker Rights Alliance. I'm a responsable de mission with the Médecins du Monde project in France. I'm on the board of National GLIMUG, the Global Network of Sex Work Project, and Red Umbrella Fund, which is the first fund for and by sex workers. And I've been a sex worker since I was 16 years old, and I'm not 16-year-old anymore. And so it's been quite a few years, and I've been working across the region, but also in different parts of the world with sex workers. About our organization, we are one of the European Sex Worker Rights Network. We have members in 30 countries, 100 organization members. Approximately half of them are led by sex workers. Our organization itself is led by sex workers, with majority of sex workers on the board and in the team as well. And maybe I can, because I'm going to forget, in the back we have a few team members if you want to say hello. So if you want to talk to somebody else, you can talk to our colleagues there. And these are our core values. We recognize sex work as work. We oppose the criminalization of sex work, which means opposing the criminalization of sex workers, clients, and third parties. And we support sex workers' self-organization and self-determination. So recently we started a research on stigma and discrimination faced by sex workers. We launched a survey that was translated in French, Spanish, and Russian, I believe, and we obtained 70 respondents who answered a series of questions about stigma and discrimination in access to healthcare. The type of sex workers were FSSW, which means full service sex worker, which means prostitution or escorting, BDSM, fetish services, creating porn, etc., working in strip clubs, and different type of work, street-based, in-call, out-call, window-based, etc. The research is still in process, so this is really like the first findings. I will tell you more when the research will be launched, which is very exciting. And the total age of the people who responded in sex work was 508 years in sex work, with an average of 7.5 years. And we also look at the different type of legal frameworks concerning sex work and the respondent, and how the type of criminalization or legalization impact stigma and discrimination. So I'm not going to go in depth in the research, just to give you like a little teaser. If you're more interested in this, I will announce soon how it's going to be published. When we ask sex workers if they have experienced stigma or discrimination, the vast majority said yes, either stigma, either discrimination, or both. The vast majority answered both, like stigma, discrimination, or both. Only 5% said no, 6% said they never experienced any form of stigma and discrimination, and 6% were unsure. And that makes a total of 667 collective incidents of stigma and discrimination. So what are the type of stigma and discrimination that sex workers faced? The main one was being asked inappropriate questions. So that's really something that sex workers will say. They go to see the doctor because they have a cold, and the doctor will want to talk to them about their involvement in sex work. Being offered treatment at special appointment times, being outed as sex workers, being advised to stop sex work. So that's a really big one. Being advised to stop doing sex work is really like one of the most common. You go to see the doctor because you have maybe like a mental health issue, or you have a different, like a physical issue, and the doctor will automatically, the doctor or the health practitioner will automatically take it back to sex work. It's like, oh, but if you stop doing sex work, things will get better. There's a reason why people do sex work. It's usually because we need the money. And telling us to stop doing sex work doesn't work. Many other issues, including like 6% physical abuse, hearing a doctor or healthcare professional gossiping about you, being verbally harassed, being exposed to extra checks, etc. This one as well is also quite sad. A doctor, nurse, or healthcare professional avoiding physical contact. So these are some of the quotes that we get from our research. I think this one is quite telling. The physician used 2 pairs of gloves. And this is a sex worker from Eastern Europe. And this is one of the most common statements in our community, is that they only see the sex worker in me. And this is something that has been said before, that we know about stigma and discrimination, is that it transforms a whole person into one single identity, and in that case, identity of being a sex worker. And another sex worker, this time from Poland, bisexual, racialized, disabled trans woman from Poland, said, "My bed and all my belongings stayed in the hallway of the hospital for the entire duration of the stay." So these are just a few quotes. There will be many more in the report that we will launch. But when we work with ESWA in different parts of the world, in different parts of Europe with sex workers, the type of stigma and discrimination that we hear are often so shocking that we don't know what to do about this. We have like organized training in like countries like Romania or Turkey and other places, France, where sex workers told us sometimes that the healthcare professional just refused to treat them. We'll sometimes ask them or physically make them leave the hospital. And the issue is that most sex workers often face different forms of discrimination. We heard from Samira earlier, like many trans women are working in the sex industry because of transphobia and lack of access to education and other forms of employment. We know that in Europe, the majority of sex workers are migrants and are racialized and face racism and discrimination because they are migrant and because they are racialized, as well as being sex workers. We know that many sex workers are also drug users and face this intersection of being both a drug user and a sex worker. So we really have to think of how we can dismantle stigma when it's at the intersection of so many identities that are stigmatized and criminalized. You're all very quiet. We just spent 3 days with 30 sex workers, which was like, and I arrived here, it's like very quiet. So I was just mentioning this intersection of stigmatization and criminalization. So I'm not an academic myself, and I'm sure there's much more that has been written about how stigma and criminalization work hand in hand. We know that the reason many LGBTQI people are stigmatized is also because of the law and criminalization of our sexual orientation or gender identity. And this is very similar for sex workers. Globally, around the world, in majority of countries, sex work is criminalized one way or another. It can be sex workers themselves, it can be our clients, or it can be third parties. And by third parties, we mean somebody who manage a place where we work, like a brothel owner, agency, online agency, website, etc. So I'm not going to go into whole criminalization. There is lots of information available on our website and on the website of the Global Network of Sex Work Project. But I just want to talk more about the Swedish model. Anybody here know about the Swedish model? Maybe I can we got 3, 4, 5, 6 people. That's great, you're gonna learn a lot then. So the Swedish model is a type of criminalization of sex work which started in Sweden in 1999. And the idea in Sweden is that prostitution is a form of violence, and the only way to have a gender equal society is by abolishing prostitution, ending prostitution altogether, and the only way to do that is not through social measure and ending poverty or ending transphobia, opening the borders. No, the only way to end prostitution is by criminalizing men who pay for sex. So as we can see, it's a really thought through model. There's nothing that can go wrong with the criminalization. And so Sweden criminalized clients, then France, Ireland, Norway, South Korea, Canada, Israel, Republic of Ireland, and Northern Ireland have introduced the criminalization of clients. And what we know is that when clients are criminalized, it makes sex workers more vulnerable to violence and HIV. So this is some quotes and some data from a report that was done in France by Médecins du Monde and service providers in France and community-led organizations in France. Only 3 years after the law, 2 years after the law, sex workers were interviewed. Almost 600 sex workers took part in the research, 38 focus groups, 17 depth interviews. And this is what sex workers, the research shows. That following the criminalization of clients, 63% of sex workers have experienced deterioration of their living condition, more isolation and greater stress. 78% of sex workers have experienced a loss of income. 42% are more exposed to violence. 38% find it harder to demand use of condoms, and 70% observe no improvement or deterioration of their relation with the police. And this report is one of the many reports about the impact of the criminalization of clients. And it just shows simply what is the impact of this law. If you criminalize clients of sex workers, there are less clients, it's true. The number of clients is going to decrease. And maybe this is a success, maybe it's fantastic for gender equality because suddenly less men are going to pay for sex. The reality is like for the people who sell sex, in particular migrant women, trans women, the most vulnerable members of the sex work communities, it means that their lives are worse. They don't have access to the same amount of money because they have less clients, they have to take more risk, they have to take clients without condoms because otherwise they won't be able to pay their rent, pay food, etc. We know also that it has increased in like isolation because sex workers are more afraid to be visible, etc. We know it has increased in violence. In Ireland, for example, there is a report of Amnesty International. We live with a violence system that look at the violence of against sex workers in Ireland following the law. So criminalization of clients is one type of criminalization, but there are many other types of criminalization. And this is, I think, one of the most important research that has been done on sex work. It's a meta-analysis or meta-survey or systematic review that looks at 33 countries between 1990 and 2018, 40 quantitative, 94 qualitative studies. And it was written by Lucy Platt and Pippa Grenfell, who look at this evidence, analyzed it, and this is their findings. There's much more to it, but a very, very simple summary is that sex workers who face repressive policing, so who face criminalization, are more likely to experience violence, poorer health and well-being. They are 3 times more likely to experience sexual or physical violence, twice as likely to have HIV or another STI, 1.5 times more likely to engage in sex without a condom with a client. And for us, this is really critical. We can talk about stigma and we can talk about organizing training for healthcare professionals to dismantle stigma. We can organize, community-led intervention to address stigma. We can organize campaigns so that people stop treating sex workers the way we are treated. The reality is like as long as sex work is criminalized, stigma will continue to impact our community. So the research that I was mentioning will be launched in December. At our conference. We have a great conference taking place. Part of the solution, sex work, public health and decriminalization. The call for proposal is closed, but we have around 50 speakers, many researchers, many community members, and others. So you will soon see a call. If you are interested, please join. And I had the last thing to say. And I'm going to have a bit more water. It's really fantastic to be here, and we're going to be here, we're going to be at EACS, and generally in the world of HIV and public health, sex workers are recognized as a key population. We are recognized that we cannot end HIV epidemic without including sex workers. I mean, I don't know if anybody disagrees with this in the room. If you disagree, come talk to me outside, during the break, and we'll work it out. But what I still find unbelievable is that while we know this is the reality, we know this is true, we still see many politicians or policymakers who are very involved in the HIV response and continue to call for the criminalization of clients. And I was hoping that Mark Angel would be here, and it was fantastic to hear him open this conference and this forum today. But a few weeks ago, Mark Angel was voting in support of criminalization of clients in the European Parliament. The European Parliament passed again a report that calls for the criminalization of clients. This will cause harm to our communities. This will cost lives to our members, to our sex workers. And it's very difficult when we try to engage in conversation. You have your opinion on sex work, great, let's talk about it, because you're simply wrong. The evidence is there, and you can't call yourself a UN/AIDS champion and call for the criminalization of sex work. This is just not acceptable anymore. And I'm talking about Mark Angel because he was opening the speech today, the forum today, but there are many others like Frances Fitzgerald, who is invited to like HIV forums, etc., and was the one who pushed for the criminalization of clients in Ireland. And for me, this is really a form of stigmatization as well. We know that sex workers are often left out in the HIV responses. And it's not just that we are left out in terms of funding, in terms of services, but also in terms of how important our communities are. They are like 4 key populations: men who have sex with men, trans people, people who use drugs, and sex workers. We can discuss, and migrants, etc. But these 4 key populations are as important as one another. We can't fight the epidemic where we continue to put men who have sex with men as higher population than trans movement and sex workers. Currently in Europe, there is a huge backlash against trans communities and against sex workers. Samira talked about it, but we need all to be united to fight this really attempt to criminalize sex workers and to attack trans women or trans communities' life. So that's all I had to say. Thank you very much. And